Welcome to the Autism Education Series on the topic of neurodiversity. The information in this presentation is meant for parents, families, and caregivers of individuals with autism spectrum disorder. And the information in this presentation is not meant to replace individualized medical assessments or treatment recommendations. If you have any questions about your child, please contact your family doctor, nurse practitioner, or anybody on your care team. Thank you for joining me today and learning about neurodiversity. This presentation was developed by myself, and my name is Lyndsay Best. My pronouns are she, her. I am a program implementer with the IWK Provincial Preschool Autism Service Team, and I am also an adult who has diagnosis of both ADHD and autism. Combined, the acronym is pronounced ADHD. I want to start with the land acknowledgement. So IWK Health is located in Halifax, also called Jabuktuk, in the ancestral and unceded, meaning never surrendered territory of Mi'kmaq people for over 13,000 years. As an IWK employee, non-Indigenous person, and a mother to two Métis children, I commit to learning from Indigenous people, reflecting on my actions as they impact Indigenous people, as well as amplifying Indigenous voices. Language guide. So here's my language guide for my presentation on neurodiversity. Autistic Canadians often have diverse and strong feelings about how they want to be identified. It's important to listen to how people refer themselves or ask if you're unclear of people's language preferences. Autistic individuals are most commonly referred to by either person first language or person, which is person with autism, or identity first language, which could be autistic or autistic child. Knowing that there's a large population of autistic adults who feel strongly about the shift from person first language to identity first language, I'm choosing to use the term autistic and autistic child throughout my presentation. Also, as an autistic adult who prefers identity first language, I recognize and respect that not everybody shares the same language preferences. And I encourage you to use the terminology that best fits your language preference or the language preference of the person who is autistic. So, what is neurodiversity? Neuro is a medical term used to refer to the nerves or the nervous system, and your brain is a part of your nervous system. Diversity is a word to use to explain the naturally occurring range of differences. So together, neurodiversity is an understanding that brain differences among people are natural and a valuable part of human diversity. And note on neurodiversity. So neurodiversity and neurodivergence is not a medical diagnosis. Neurodiversity is, however, an umbrella term, which means that it's a broad term used to describe multiple things rather than something specific. A perspective on neurodiversity. So here are a few reasons why somebody might call themselves neurodiverse or neurodivergent. Neurodiversity can be an all-encompassing term that helps people explain that their brain functions differently and that the way they view and experience and interact with the world may be different than most people. Neurotypical is a descriptor that refers to somebody who has brain functions, behaviors, and processing that is considered standard or typical. As neurodivergent are environments like schools, workplace, and grocery stores tend to accommodate neurotypicals. And that's part of the reason that the neurodiversity movement currently exists, to shift people's perspectives about what's considered normal. Sometimes people call themselves neurodivergent or neurodivergent because when they say that they're neurodivergent, it's a way to advocate their needs or explain that their brain works differently. People have reported to use this term to help protect themselves from the stigma of certain mental health disorders and or to maintain the privacy of their diagnosis. So, people who may use this term may include, but are not limited to, autism spectrum disorder, attention deficit hyperactivity disorder, learning and communication disorders, Tourette syndrome, post-traumatic stress disorder, fetal alcohol spectrum disorder. But people with these disorders or conditions may not choose to identify themselves as neurodivergent. And it's also common for neurodivergent people to have co-occurring conditions or more than one diagnosis. A neurodiversity symbol is the rainbow infinity sign. So this image is used to symbolize both autism and neurodiversity more broadly. Another symbol that's widely used in the autism community is the gold infinity sign, or another one that's accepted is the chemical symbol for gold, which is AU. The rainbow infinity sign is widely accepted among the autism community and replaces the puzzle piece that was previously used. Autistic adults have advocated to move away from the puzzle piece symbol because an organization originally and thought that autism was a puzzling disorder, which implied that they were a puzzle needing to be solved or that they were a missing piece. So there's some take-home messages about what it means to be neurodiverse. Neuro is another word for brain, and diverse means different. So therefore, the term is used generally to explain somebody whose brain works differently than the majority. Neurodiversity is not a diagnosis. It's a broad term used to explain generalities versus something that's very specific. People who have mental conditions or disorders may not use the term neurodiverse to explain themselves or their brains. And we encourage you to have a conversation with your care providers or support team about things that you have heard about regarding neurodiversity or any questions you may have. Here's my references. And thank you for watching this video to gain more understanding about neurodiversity. I hope it's been a helpful learning tool.